Mr. President, this is Jane Knockin of Minneapolis. Your question for the President?
Mr. President, untreated addiction is a huge factor in the rising cost of health care. The American Medical Association tells us that about 40% of hospital days and over 50% of emergency room visits are for alcohol or other drug-related causes, illness or accidents. I'd like to know, with your benefit for substance abuse treatment, which, as you mentioned, is there now along with the mental health, you've been taking a lot of flack on the cost, but we know that treatment cuts medical utilization in half immediately, not only for addicted persons, but for their whole family members. Can you do a better job of defending that? And how far are you going to go to keep this benefit in the final legislation on health care reform?
I don't know if I can do a better job of defending it. Some days, I don't think I do such a hot job. I did my best when we started tonight. But I'm going to try. Let me say, I think you may know this, but I have a brother who is an addict, who is a recovering addict. I know that treatment works. And we have done two things in our administration. One is to require that drug treatment be a part of the benefits as a part of a general approach to preventive health care. I believe in preventive health care, folks. We spend a ton of money after the cow's already out of the barn door in our health care system. And I like it. I mean, I like the fact that we have the best technology in the world. I like the fact that we can get it. But we can save so much money if we just invest in prevention generally, whether it's mammograms for women or cholesterol tests for people or substance abuse treatment. In addition to that, although I just presented a budget to the Congress that cuts defense and cuts discretionary domestic spending, that is not Medicare, Medicaid, or Social Security, for the first time since 1969, we increase in our regular budget drug treatment funds by, about 8 or 10%, just because I think it is so important, and I will fight very hard for it. I think it would be a big mistake for us to back off of this. There's still an awful lot of people who have alcohol and drug abuse, substance abuse problems in this country, and we can save a bunch of money and a lot of people, more importantly, if we stay with it.